1 in 8 women will develop breast cancer in her lifetime, and 1 in 833 men will develop breast cancer in his lifetime. And of the younger women who get breast cancer, they usually don't detect it early enough, and it's usually more deadly and invasive. Knowing the risk factors of breast cancer is an important part of knowing your likelihood of getting it yourself. Genetic mutations are the biggest contributor. If someone has something known as a BRCA1 or BRCA2 gene mutation, they are more likely to get breast cancer. If you have an immediate family member who's had breast cancer, your risk of cancer doubles. A lot of the risk factors also include the amount of time you're exposed to the hormone estrogen. Estrogen is a big player in breast cancer, and some examples of this are if you've started your period before 12, or start menopause after 55, if you're on hormonal birth control, or if you're on hormonal replacement therapy, or if you don't breastfeed any of your kids. These all increase your exposure to estrogen, which makes you more likely for breast cancer. Having dense breasts can also lead to breast cancer. It's because dense breasts have more connective tissue than fatty tissue, and that makes it harder to see tumors on a mammogram. If you've already had breast cancer once, you have a 3 to 15% chance of getting breast cancer again. If you had radiation therapy to your chest before you've turned 30, you are also at a higher risk of breast cancer. Lifestyle factors are also a huge role in breast cancer risk factors. Being overweight, not getting enough exercise, and drinking alcohol make you more susceptible to breast cancer as well as many other health issues. Having your first child after 30 can also lead to breast cancer. If you've never had a full-term pregnancy, again, your risk for breast cancer is increased. When it comes to signs and symptoms of breast cancer, most people know about the lump in the breast or the armpit as a sign of breast cancer. However, there are a lot more signs and symptoms that can develop that may mean you have breast cancer. Some of the signs may simply be due to hormonal changes or other issues in life. If any of the changes stick around, that's when you'll want to see a doctor, as they will be more equipped to know whether or not it is breast cancer. Some other signs and symptoms that you can look for are dimpling in your breast, red, flaky, or irritated skin anywhere on the breast or nipple. If your nipple didn't previously look inverted and now it does, that's also a sign of breast cancer. Anything other than milk when you're breastfeeding coming out of your breast is a sign of breast cancer, and that includes blood, pain in your nipple or breast, change in size not related to puberty or other reasons, indents on your breasts, or any growing veins are signs of breast cancer. It's important to understand that the single best way to treat breast cancer early is to screen for it. Of those who were able to detect cancer early, their 5-year survival rate was 99%. So if you're able to detect it early, it's incredibly treatable. There are some important time frames to be aware of. Once you turn 20, it's important to start doing self-breast exams. At around 25 to 39, you're supposed to start getting clinical breast exams. At 45, you should get a mammogram yearly. When you turn 55, you can opt to get a mammogram every 2 years instead. If you have a family history of breast cancer, these numbers will look different and you will usually start screening at a younger age than is suggested. It's important to talk to your doctor about when to start these screenings if you are at higher risk. Now I will go into some deeper detail about some of the screening methods that you may not be as familiar with. Self-breast exams are a process that every woman should do monthly. If you have a period, do this exam about a week after your period. If you do not have a period or it is highly irregular, do it on the same day every month, usually on the 1st or 15th day of the month. This exam involves feeling your breasts and into your armpits with the pads of your fingers. It also involves looking in the mirror at your breasts as you place your arms above your head and on your hips. This helps you to become familiar with your breasts, and you can more adequately recognize when there are any issues. It turns out that 71% of cases in women under 50 are found by women themselves. If you want to have an in-depth description on how to perform a self-exam, you can go to the National Breast Cancer Foundation's website and find the information there. Clinical breast exams are very similar to self-exams. However, your provider will be the one who is looking at your breasts in the various positions and feeling around for any lumps or abnormalities. They should be performed every 1 to 3 years, and your provider will have the expertise in order to find some lumps that you may not be able to find. They also will be able to feel your lymph nodes for these issues as well. Prevention is just as important as screenings, so be sure to use your common sense and eat healthy and exercise. If you are drinking alcohol, do so in moderation. If you're not drinking alcohol, don't start now. If you are on hormonal therapy or taking hormonal birth control, it may be wise to speak with your doctor to see if it'll increase your risk of breast cancer. If you are able to, breastfeed your children. Breastfeeding helps prevent cancer because it reduces the amount of time that you're exposed to estrogen. Doing your family history is also an important part of prevention. If you know you are more at risk, you can start to take the steps earlier to detect breast cancer at the earliest stages. By being aware of breast cancer, it helps us become closer to overcoming this type of cancer. Again, early detection leads to better results. Part of this includes spreading information to your friends and to your family. It may feel uncomfortable to talk about breast exams with your family and your friends, but it's incredibly important to make sure that everyone is getting these screenings done so they can limit their chances of getting breast cancer. So be sure to break the taboo and share the news that breast cancer screenings save lives. Thank you for watching, and if you need any more information on breast cancer, you can look at the National Breast Cancer Foundation's website. If you also want this information in a pamphlet form, there's a PDF online if you scan this QR code. Thank you so much again, and please be sure to share this video with your friends.